The following segment is brought to you in partnership with Future 42. Turn your frustration into action at future42.org. Last week on the show, I told you we're going to be looking for more opportunities, more stories about the people being the watchdog. I talked about the death of my friend Dory Monson and how I think he was one of, if not the most effective watchdogs of government in Washington state, and his loss leaves a huge void there. And in the absence of a robust and effective media climate, more and more people have to be their own watchdogs. They have to stand up when they see something that's not right, and they have to do something because you can't rely on the media to do it. You can't rely on politicians always to do the right thing. There's a great example of this happening up in Lynnwood, Washington right now, where residents are protesting, speaking out about the fact that the state of Washington and Acadia Health are about to open up an opioid treatment center in Lynnwood. Now, that's not necessarily a bad thing. You need these treatment centers to be somewhere. The problem is, it is just a few yards from a boys and girls club, which is supposed to be a safe place for young kids and teens. And so you have all these parents who are like, what the heck? One, we didn't even know about this. Nobody told us until December 29th was the first opportunity for public input. This thing was scheduled to open at the end of this month. So you give people a month when you've clearly already decided that you're going to open it. The permits are in place, it's been remodeled. So it's like the state was just checking off boxes to say, oh, it requires public input, check, but not really listening. One of the other people very upset with the way all this went down was Lynnwood City Council President George Hurst. He did testify during that public hearing on December 29th. Here's a bit of that.
I feel we are just part of a check the box process. The state will hold a public hearing, check. Acadia will meet with the council, check. A few stakeholders will be briefly contacted with a short visit or voicemail that is left, check, check. All happening after the tenant improvement for the OTP has been finished and is ready for occupancy at a site a few hundred feet from the Alderwood Boys and Girls Club.
I invited Council President Hurst on the show to talk about his real frustration with the state and Acadia Health not doing more to take the concerns of the public to heart. It's not every day Lynnwood has a sort of community uprising of that nature.
Yeah, no, they're very social media savvy people. That's how they organized, and that's great. The ironic part of this is most of them probably are not, quote, city residents. They are probably unincorporated Snohomish residents who have a Lynnwood address, but that doesn't matter. What really matters is we have to figure out a way, if this is going to happen, we have to figure out a way to make them feel safe. We have to figure out a way to, I'm almost thinking about, can we form some sort of oversight committee with these folks who are so interested in what's going on, and they want to make sure that their community is safe. The ironic thing, though, is that there was comments about the Alderwood Boys and Girls Club that they have problems with drug use there now. They have to take their vans home so that they aren't vandalized in any way. So if this is a problem area, I think Lynnwood Police, now we know the Alderwood Boys and Girls Club is in the city of Lynnwood. It's our jurisdiction. Maybe we need to do an emphasis patrol there and help that area be safe as well. And maybe this clinic would draw attention to the fact that yeah, we need more security up there, and let's clean up this neighborhood.
And just to be clear, you're not saying that there's drug use in the Boys and Girls Club. You're saying around it there have been some
on their property. Yeah, they find needles. There's transients. The neighbors complain about people parking on the streets and cars. Drug deals happening. This is all just hearsay, of course, but it's a real concern for those folks. So yeah, I was really impressed with how they came. They talked. They told us their concerns. They are a really good group dedicated to their neighborhood, and that type of engagement, man, that's fantastic.
Yeah, I don't like to think the worst of people and the worst intentions, but when you, as we started, listed off all the things that had kind of been promised or gone wrong that was supposed to happen that didn't, going back to March, and then you get this email saying, oh, there's going to be a public testimony for a date that's 5 months in the past. Do you think any of this was intentionally to prevent any sort of input until it was too late, or do you think it was just sort of a lot of unfortunate oversights?
I think on the part of the State Department of Health, I think they copy and pasted a letter, and had the wrong date in it. They what I got from our council meeting, I did invite the Department of Health to be there, and they could do it via Zoom, and it was great. There were 4 of them there, but they were, all they were interested in is making sure they complied with the RCW and made sure that all the steps were being followed. And yes, they are being followed, but there are just some ramifications for these actions that we need to look at. I am not as I think Acadia, they have, I think, 8 methadone clinics in the state of Washington. They have over 150 somewhere in the United States. They are very experienced, and I think they're experienced at keeping things at a low level of information. And I think that's their outreach was terrible. When they were supposed to contact the Edmond School District, a voicemail was left at a general phone number, and no follow-up. They contacted our police department. We have a community health and safety division. They contacted the sergeant via email on this and said, hey, this was in September. Hey, we're coming into your town. We like that you have this division. We would like to cooperate with you. We're going to let you know, what's happening. But that was it. That was it. One email, no other response. Obviously they didn't contact the city council and let us know what was going on. Their outreach, like I said, they didn't contact the Alderwood Boys and Girls Club. There's a working small education farm not far away that they do things with school kids. They were never contacted. It was like, really? You just, you did the minimum. You did the minimum to fill out your little form to say that you did some sort of outreach. And they say, well, the outreach program is a dynamic thing. It grows, and when there's concerns, we'll change and all that. But that doesn't help the fact that at the beginning, people felt like, where did this all come from? And
Yeah,
now I'm getting,
rightfully so.
yeah, and now I'm getting an email I got it may be that the owner of the building wasn't quite clear what type of clinic was going in, because when the permit was requested, it was just called a medical clinic, which fit into the zone that this building was. But an idea, yeah, if a TI of a medical clinic in an existing medical building, yeah, that sounds pretty safe. But when you put in opioid treatment program, or more likely methadone clinic, then I think that would light up some warning signals.
Yeah.
Would you just let people know what's going on?
Right. And then you plan for it. Like you said, I mean, you have to be honest about public safety risks that come along with that, about there being kids nearby. I mean, it's just common sense stuff. And I think a lot of this could have been avoided had there been earlier, better communication. If there is a true reassessment of this location, are you willing to work, and is the city willing to work with Acadia to perhaps find a better location to suit their needs?
Yes, the Bothell location was in Canyon Park, a light industrial area. We have light industrial areas around Highway 99, which has a superior bus system. If people want to use a bus, what I've been told, most of the clients, they actually drive, and it's a 10-minute visit to get the methadone. Then they're off to a job or their family, just because they need help to fight the addiction. But yeah, I can't believe they could not find a location on 99 or somewhere in a light industrial area in our city instead of a residential area with a Boys and Girls Club across the street. It doesn't, it boggles the imagination, the mind. Yeah.
It truly does. I mean, you had also on that public testimony, quickly, there was a Democratic state lawmaker who testified on behalf of it. Have you tried reaching out to her office to express your concerns?
Yes. Yeah. That's Rep. Lauren Davis. Mm-hmm. Her focus in the legislature is drug addiction and mental health. I trust her judgment and her knowledge of what methadone does. In fact, one of the things she talked about at our council meeting was that we really now in Snohomish County have a fentanyl problem, and that methadone is the only thing that really kicks the fentanyl addiction. But at the same time, I know, Lauren says she welcomes this clinic. I think I do too, but not in this location. And I know that sounds pretty NIMBY, and she knows that, her comment was, every clinic has objections to it, right? But this one just seems to be so severe, But we in Lynnwood, we're building a new community justice center, which is a police jail facility. But right adjacent to it, within the same building, is a community recovery center. So we're going to have people there for mental health and drug addiction. And a methadone clinic in our city would be really helpful for those folks there who are seeking the treatment. But yeah, let's get it closer to that facility, not on the outskirts of Lynnwood. Maybe, let's get it. I still think somewhere 99 on Highway 99, we could get a good facility there, and it would be a win for everyone.
Yeah. And I don't think it sounds NIMBY at all. I think that's one of the, we're so into labeling, and we see that a lot in Seattle, that label NIMBY, when you express concern about, the homeless crisis and it's spilling into city parks. And it's like, no, we should be able to have reasonable conversations about legitimate concerns. And this is a legitimate concern. So I hope you guys can work things out up there. I've been fascinated by it. Whenever the community comes up like that, so grassroots, it's like you said, awesome that they care so much.
Yeah, no. And, we're going to keep in touch with them and let them know all these steps, because we're going to be very transparent on this process. Whether it's we were somehow able to move this clinic, or if we can't, then we're going to figure out a way to make it work. It just is so unfortunate. It's like it was set up to become a huge problem, and it should have been, like you say, education should have occurred. If we could have started talking about this in the summer and talk and get the community together and the neighbors together and figure out this thing, but to do this all on holiday week at 4:30, have a public hearing, what is the State Department of Health thinking?
So we are going to be staying all over this story. Again, it's a great example of what can happen when the public decides to be its own watchdog, when the public decides to push back, make their voices heard. It can be a very effective thing. And we know that the state is now kind of reconsidering things, reevaluating things, given how much public pushback there has been. The previous segment was brought to you in partnership with Future 42. Turn your frustration into action at future42.org.